Hi, everyone. I'm Congressman Jim Himes, and this is a pretty exciting night because the president is giving his first, it's not really the State of the Union because he hasn't been president, it's known as a joint address. Needless to say, this has been a topsy-turvy month and a half since January 20th. And one of the things that I'm very, very worried about is that the Republican budget, which is supported by the president, is going to cut Medicaid. Now, we had a long argument last week in which the Republicans said, oh, no, it's going to be just waste, fraud, and abuse. But I promise you, there is not $880 billion of waste, fraud, and abuse in the Medicaid system. Now, Medicaid is an abstraction to a lot of people. If you've got employer-provided health insurance, if you've got other private insurance, you may not need Medicaid, but you would be amazed by the effect that Medicaid cuts could have on our communities because it's grandma at an assisted living facility. It is children who don't have other options for healthcare. And if there are substantial cuts to Medicaid, our hospitals will be badly hurt because they take a lot of Medicaid patients. But they won't be as badly hurt as our community health centers. And I'm just delighted to have as my guest at the speech tonight, Mollie Melbourne, who is the CEO of Southwest Community Health Center, which provides healthcare and often is the only provider of primary healthcare in the city of Bridgeport, the single biggest city in the state of Connecticut. And Mollie sees and understands really what would happen if we saw substantial Medicaid cuts. So Mollie, thank you so much for joining me. And maybe, for people who aren't, super conversant in what exactly Medicaid is, what are the implications if we see dramatic cuts to the Medicaid program?
Sure. Well, I think there are a couple of layers that we are really concerned about. Number one would be eligibility. So fewer people would qualify for Medicaid, which means then they wouldn't have an access point to really enter the healthcare system. So Medicaid covers your primary care services and your preventative care services. So that means that when somebody is sick, if they don't have Medicaid, they will have a hard time finding a provider to treat whatever illness it is that they have, which then would mean that they end up at the emergency department instead of getting that care at the primary care level.
It's children's first visit to the doctor,
Absolutely.
right? Vaccines.
Absolutely. Vaccines,
Yeah.
ear infections. We also have a lot of pregnant women on Medicaid. They need to have regular appointments to ensure that their babies are developing healthy. And then they get through a healthy delivery, and then Medicaid will cover them for another year. So make sure that they are able to get through the year after giving birth in a way that really truly helps them recover and move forward. So it is critical that we have access to Medicaid for our patients. I really think of primary care as the foundation of healthcare. It's what everything else is built upon. And if we have a disruption in the foundation, everything else is going to be impacted as well. So it's not just primary, it's not just hospital, it's the whole healthcare system that we are so interdependent on to really ensure that it's functioning the way it should. So our community, particularly those members of our community who are so vulnerable, to ensure that they have access to the care they need so they can get healthy and stay healthy.
Now, you already, my understanding is that in the sudden freeze of federal funds, you already had a couple of very tense weeks where you couldn't access critical funds that you needed. Now, I know in the end it worked out, things got restarted, this is all being fought out in the courts, there's sort of chaos out there, but there were a couple of really scary weeks there for you, right? What were you guys thinking inside the health center? Were your people, I imagine they were probably nervous?
They were nervous. We were nervous. I think everybody was nervous. We looked at how long we could sustain without federal funding. We looked at contingency plans in terms of how we would maximize what we had to ensure that we could keep our doors open and serving our patients as long as possible. For us, it's all about making sure that our doors are open, our patients can come in and get the services that they need. Our concern with cuts in funding would be that we'd have to close sites. We'd have to reduce hours. All of that affects access to healthcare. We might have to reduce some of our services. These all add up to suffering for our patients. And so we are working really hard to make sure that we do everything we can, which is why I'm so thrilled to be here, to advocate for health centers and ensure that we have Medicaid rates that are appropriate and cover costs, that we have the funding that helps us pay our staff and ultimately stay in business to serve our community.
And, Medicaid, of course, is there in addition to providing care for the elderly who run out of assets. So that's it's grandma in the assisted living facility. It is really the source of healthcare for most lower income Americans. And certainly, I think the number in Connecticut is as many as 1 million-ish people, a little shy of 1 million people who rely in the state of Connecticut for their healthcare. But sometimes people hear poor people, right? And they don't understand, and you tell me, but they don't understand that we're not actually talking about what you may think of as stereotypically poor people. We're talking about kids for the single mom who's a teacher,
Absolutely.
right? I mean, we're talking about working Americans who, because healthcare is so expensive, we might not think of them as poor, but this is their only access to health insurance, as it were, right? I mean, who do you see coming through the doors?
So we see a lot of folks coming through the doors, but you're absolutely right. It is frequently someone who is working poor. They're struggling. Connecticut's a very expensive place to live. So just a basic apartment in Bridgeport could run $1,500, $2,000. If you are on a lower income, maybe not the stereotypical poor, but how you put all of the expenses together over the course of the month doesn't leave much for healthcare. And so Medicaid really is an incredible resource. And Connecticut has a wonderful program through the Husky Health that provides that foundation, that ensures that the kiddos who are being born to moms on Medicaid, the young kiddos after they've gotten a little bit older have access to the services they need, that again are working poor folks who are struggling to make ends meet, that they have access to resources that help them get the healthcare that they need. So it is just absolutely critical to our population, to our community, to our state. And at the end of the day, it helps make people healthy and keeps them productive.
Last question for you. One of the things I love most about Southwest and your ecosystem, your network of other community health centers, is that because you're trusted by a population, often a lower income population, you make referrals. Somebody comes in and you realize this person may actually be living in a car, or somebody comes in and you realize there's an addiction issue there, homelessness, even something like, I've heard the health centers recommend tax preparation programs and stuff. You are a lifeline in more than just traditional primary healthcare. And correct me if I'm wrong, but a lot of those programs that you refer people to that are part of dealing with the whole person, not just healthcare, but nutrition, those could be jeopardized if we see very dramatic cuts in federal grants, right?
We've already seen a couple jeopardized. They were defunded. So the community really works as a system. We rely on one another. We recognize that we can't treat the whole person without our partners. We also understand that a lot that affects healthcare doesn't happen in the exam room. So we rely on this system to ensure that, as you said, someone who's experiencing homelessness has access to an organization that can help them get into the shelter and then transition to housing, making sure moms have the ability to get diapers for their kiddos, pay their electric bill. These are really critical resources. And we are already seeing some of these organizations start to lay people off. We have seen one get completely defunded, an organization that's focused on homelessness. So we're very worried about what this means for our overall community, because it does really, truly take a village. And we have a beautiful village in Bridgeport, but we need all of the members of our village to be there to help our community.
Well, thank you. I'm so glad you're here. It's not necessarily going to be an easy evening, but hopefully your presence here will paint a picture for what it is that's at stake here. And people need to understand what's at stake, because it's kind of gets to how good of people are we. So I'm so appreciative that you're here.
Thank you so much for having me.